Hello, my name is Yusof. I'm from Leeds, United Kingdom. Today, I'm reporting on the behalf of Rumnal faculty. There's been many abstract presented today, but the one that caught my eyes today is about the importance of treating to target in lupus. As we know, over the last 5 years, there have been many emerging therapies, and many also have been licensed recently. So therefore, we need to improve how we treating the patient. So in this study, abstract 0865, this is a multi-center study looking at mortality of patients with SLE. It's a very large study involving 2,040 patients. So the follow-up is 7 years. However, the median follow-up in this patient is about nearly 3 years. So in these studies, there were 2.3% death, and a majority of the deaths were due to infection. So infection is still the biggest problems, and about 20 to 30% due to the disease itself. So they were comparing which targets would be best in order to reduce mortality. So they were comparing whether patient can achieve LL-DAS 50, meaning they were achieving LL-DAS state 50% of the time, or the DORIS remission, or the best in the target, which is clinical remissions on therapy and also of prednisolone. So in this study, what they found, the best target would be clinical remission on therapy, but also of prednisolone. If we manage to achieve this, this will reduce the mortality by over 80%. However, in this cohort, this was only achieved by 14% of the patient. So maybe it's not realistic. So comparing LL-DAS 50 and also DORIS remission. So just trying to recap in terms of the difference between two is that the dose of prednisolone in LL-DAS was set, equal or less than 7.5 milligram, whereas the DORIS remission is equal or less than 5 milligram. So what they found, there's not much significant difference in terms of reduction in mortality. So the mortality reduced by 56% in using LL-DAS 50 compared to DORIS remission is around 60%. So there's not quite difference, but LL-DAS 50 was more achievable. It was achieved in about 50% of the patient, whereas if you use the DORIS remission criteria slightly stricter, it's only about 30% people achieved it. Therefore, so what's the implication this to clinical practice? I think it is time now for us as a clinician. We should, when we see the patient, even from the inception, from the beginning, we need to set target to the patient, and we need to increase our intensity of the therapy in order to achieve the target. And I think the target that's achievable is LL-DAS 50. Thank you for listening. So make sure you follow me at my Twitter handle at Yusof, and also follow the room now.